Hi, this is the second video of my laser eye surgery. It's now 26 hours since I had my eyes lasered. I did a short little video yesterday just to show what my eyes looked like after 6 hours. But I didn't really talk through the procedure or anything like that because I was still in pain. So today I'm just going to explain the procedure that I had and what it felt like. I had LASIK eye surgery, which is the one that creates a flap around your cornea. There's another one that's LASIK that scrubs away the cornea of your eye. So I had LASIK. I went yesterday at 9:30 and my surgery was at 10:30. I met the surgeon before having it done, and he basically just checked my eyes, asked if I had any questions and things like that, and said he was prepared to go ahead and do it. I was then taken back into the waiting room, and then taken through to the preparation room. They give you a hat to put on and put some cotton here so that the drops don't run out while you're having it done. Then I was taken through into another small room that was just outside of the surgery room, where I could hear the lady before me having it done. Waited 10 minutes, hers finished, and then I went through. They got me to lay down on a bed. My head wasn't clamped. I've seen some videos saying that people have had the head clamped into place. Mine was just placed on a pillow, special cushion with a dip in. So I laid down, did that. And then they put two drops of numbing in each eye, anaesthetic. And I expected to be waiting 5-10 minutes for that to start working, but they started straight away. I could feel that it was working because the rim around here, the rim of my eyelid, went really, really numb. Okay, so they had two machines. The first one was the machine that creates the flap around your eye, and then next to it was the laser machine that does the laser correcting. They applied, how can I explain it? It was just like a round rubber sucker thing to my eyeball, and then put a clamp in to widen it up. And then the machine came down and attached to the sucker, and then they put the suction on, which to me was one of the most uncomfortable bits. It wasn't painful, but it was like a pressure and a dull ache on my eyeball. So they did that. They talk you through it all the time, explaining what's happening, and the nurse was really nice. She held my hand. Okay, so the suction started, and then the machine came down. Before I went in, I'd said, I got a bit of a worry, and I'd said, what if my eye moves during the procedure? But they explained that the machine that creates the flap and the laser will not work if they detect any movement in your eye. It will just stop, which put me at ease a bit. So the machine came down, the suction attached, and then I think it was about 15 seconds just stare into, I couldn't really see, to be honest. It just blurs. It's that tight that your vision just blurs out. I didn't hear much noise, but the nurse counted down 15 seconds to do the flap. Okay, and then they removed the suction, left the clamp in, moved to the other eye. Same thing. So yeah, I'd say that's probably the worst bit. And then they removed the suction and the suckers, moved me across onto the next machine. The next bit was maybe a little bit squeamish. Once the flap's being created, they have to peel it back, and it uses like a metal tool with a thin piece of metal to kind of flip it back. And obviously, because you can't look away, you see the metal coming towards your eye. When he did it on my first eye, which was this one, I flinched a little bit and it caught my eye. It wasn't painful, I couldn't feel it, but the surgeon just said you need to keep still. I'll try and show you. I've got a little mark, if you can see. There, a little red mark just there. That's from when I flinched and it like kind of poked my eye a little bit. It wasn't painful. So then he moved me on to the next machine, and I was still clamped open, both eyes still clamped open. The machine comes down, and it's like a bright, you look through, like just a bright ball of red, kind of fuzzy light, obviously keeping very, very still, no moving or anything. And then the nurse counted down that my actual laser time was only 5 seconds on each eye, but the lady, when I was waiting to go in and I could hear the lady before me having it done, hers was 15 seconds on each eye. So I suppose it depends on your prescription. Mine, by the way, was -3 in my right eye, -2 in my left. Okay. So the nurse counts down like 5, 4, 3, 2, 1, and then it's done. You can smell, obviously, burning eye, which didn't really bother me. It just smells like if you set some hair on fire. That's all it was just like a little puff of that. And then move on to the other eye. Same again. And then that was that. The laser in itself was absolutely fine, no problem. And then after that, they have to put the flaps back down. And the only way I can think to describe this is like when you're wallpapering or putting a tint on some windows, like they have a tool to smooth the bubbles down, and they flip the flap back down, and then I could just see him with a little white brush, just kind of brushing all the air bubbles out. That was that. All through the procedure they put drops in. I think they're the antibiotic drops. So that was that. The flaps were put back down, and then the nurse slowly sat me back up. Altogether, the whole time in the room took 15 minutes at most, in the surgery room. The nurse sat me back up, walked me back through into reception and into a recovery room, which was dark. I still couldn't feel anything, felt no pain whatsoever. My vision was, I could see, but it was blurry. It was like if you get cream or oil or something in your eye and there's like a film, it looked like that. So I sat in the recovery room with my boyfriend who came with me for 10 minutes, had a coffee, just waited, and then the optician called me through. So I went through so she could just check through the machines again, check it basically looked alright, which it did, and they said I could go. My eyes were still numb, so I couldn't feel anything, and I'd been advised at my consultation, I only had my consultation on Monday, it's Friday today, and I had obviously my surgery yesterday. They'd advised me that it wouldn't be painful. When the drops wear off, you'll have some discomfort. Now, because I've just been told it's discomfort, we planned to walk. I had it done in Leeds, so we planned to just walk around, find somewhere and get some lunch. 'Cause it was about 12:30, 1 o'clock. So as we were walking to try and find somewhere to go for some lunch, it started to wear off. The drop started to wear off. I'd got my sunglasses on, and it was getting more and more intense. I wouldn't describe it as discomfort, I'd describe it as pain. It was like, I'm trying to think, the only way really to describe it is burning. It was like salt and chili and having shampoo in your eyes, just an intense burning, stinging. Anyway, we carried on walking for about 5 minutes and then it just got too much. There was no way I could sit and have something to eat when I couldn't keep my eyes open. And I don't think it helped that we were in Leeds city centre. It was busy and the sun was absolutely blaring. So we made our way back to the car park, and that 10-minute walk was awful. It was painful. I couldn't keep my eyes open. They felt as though they were just swelling and really, really closing up. But when I'd had my consultation just before I went in for the surgery, the nurse said the best thing to do afterwards is just go home and go to bed. So we got in the car, and it was just such a relief to be able to shut my eyes. I couldn't keep them open. On the drive home, which took about 35-40 minutes, the only time that I could force my eyes open was just to let the constant stream of tears out my eyes. They were just pouring. It was burning, stinging, just really, really painful. I mean, I might have just sensitive eyes, but normally I have quite a high pain threshold, but it was uncomfy. So anyway, I got home. I had something to eat. I had a sandwich with my eyes shut because we'd got up really early and not had time for breakfast. And then I went straight to bed because I just couldn't do anything else. When I was at the surgery and just before I left, they gave me a bag of medication. I'll just basically show you what's in there and explain what there is. You get 2 bottles of Exocin, left and right eye, obviously to prevent infection, and 2 bottles of drops that are called FML. I don't know which one is which, but one is an antibiotic and one is a steroid to prevent swelling. So I put my first drops of each, leaving 10 minutes between before I went for a sleep. I also got these, if you can see them. They are eye shields that you need to tape to your head for a week after the operation, and they go on like this. These are basically just to prevent you from rubbing your eye and getting anything in it while you're sleeping. So my boyfriend taped these to my eyes, and I went straight up to bed. This was, by now it's about 2 o'clock. I slept for 2 hours. It was still really painful when I went to sleep. I took 2 paracetamol as well, because the clinic don't give you, well, they didn't give me any kind of pain relief or pain drops or anything like that. Went to sleep. I woke up at 4, and straight away my eyes felt better. They were still felt really, really gritty and bruised and still a little bit sore, but it was bearable and I could keep my eyes open, which I couldn't do before. I came down, well, I stood up and looked out of my bedroom window, and straight away I could tell my vision was a lot clearer and I could see a lot further than I normally can. Went downstairs. You're not supposed to watch TV, go on the computer, etc, etc. But I turned the channel over, and normally when I'm sat on the settee, the Sky like description box thing that comes up, I can't read any of it without any lenses in, and I could read every single word of it. So yeah, just chilled out the rest of the day, and the pain gradually got reduced to basically nothing. I went to sleep at night, woke up this morning, they were a little bit tender. Oh yeah, I also got these. Oops. Which are fake tears, and they just tell you to put these in as often as possible. The more you do it, the more comfortable your eyes will be. So I put those in when I woke up, put my other drops in, and then I went outside and my vision was amazing. I could see everything really, really clearly. I'm not in any pain. And then I went for my day after checkup. Basically it's just with the optician. She just looks through the machines at your eyes again, and then she put the letter chart thing on the wall and asked me to read the smallest writing that I could, which was the bottom line. Now the bottom line is 20/20 vision, so I read that straight away and I was really, really pleased. And then she brought up an even smaller line of letters which I could read no problem, and then she said that is better than 20/20 vision, and it's really, she said it's quite rare to be able to read that the day after your operation. So I have better than 20/20 vision on the first day after my surgery, so I'm really pleased with that. What else is there? My eyes still feel bruised. Now I noticed this last night, I'll try and show you. When they attach the suction to your eye, it's left like a ring of bruising, which I can feel is tender when I blink. I'll try and show it to you. If you can see that. It's like just a ring, and it's mainly on my left eye. The right one has got a little bit, not a lot. So that's that. I've got another checkup in 2 weeks. I've got to keep on with my drops for another week. The optician said I could drive, which is good. I've been watching TV, going on the computer. Everything's fine. If my eyes start to feel a little bit tired, I've obviously stopped what I'm doing, put some drops in and just shut them for a bit. But other than that, they're fine. I'm really pleased with the results. I had it done at Optimax, which is also Ultralaser. It's the same company in Leeds. The original price should have been $2,888, but until the end of August they've got an offer on and it's a $1,995. So that's nearly £1,000 off. What else is there? Yeah, I think that's about it. Overall, good experience. I'd definitely do it again. It was definitely worth it, but it would have been nice to be advised that it is a little bit painful, not just discomfort when your drops wear off. But yeah, really pleased with that. So I'll do another video maybe tomorrow or in a couple of days when the bruising starts to go down. And yeah, so okay, bye.